Welcome back, dear viewers. That was a short report about school activities and the importance of a lot of the school administrations and parents to ensure that the kids are involved in many activities as they can. Because you know, when you're like a child at a young age is involved in school activities, they're able to broaden their thinkings, their creativity, and their experience. So hopefully, in the beginning of the school years, a lot of the parents, you have many of say opportunities to ensure that your kids has the most potential they have in their future education. And coming up next, our guest, our next doctor would like to welcome back to the show Dr. Mظفر Abuziad, who is a general dentist, and today we'll be discussing about cosmetic dentistry. So we'd like to welcome back to the show, Doctor. Assalamu alaikum and good morning.
Good morning.
Dr. Mظفر, today cosmetic dentistry is becoming more and more of a topic many people discuss, whether it's young age or especially in adults. And many of the people they consider like when they're fixing the dentistry, or say like today's topic about bleaching. Why is it's becoming more and more of an like something that they look up to as having a white teeth? Is it because of the idea of Hollywood, or what is it?
Okay, firstly we will make definition of the cosmetic. What's the cosmetic dentistry? The cosmetic dentistry is used to refer to any dental works that improves the appearance of the person's teeth, gum, and or bite. So, but to the success of the cosmetic dentistry, we have to know that it's not only the external appearance of teeth is important, but always we have to make the mouth and teeth work correctly. This is the important. So you know that now this is the media word. You have to see the actors, the many people. The appearance of their teeth, the beautiful smile is very important nowadays.
Indeed. And Dr. Mظفر, what's the average age when kids can whiten their teeth? Because I'm sure nowadays you see in the reports where parents took their young ones at a young age, you know, you expect them like 12 or 15, they want to get their teeth whitened because they're not happy with a smile. They say this actor or actress has it. So they feel like at that age, this is the age where they have to have the perfect smile. Why is that so? What's the age for it?
So the age for bleaching or any, it starts on 18 years.
When they're adults?
18 years, yes, we can start. For the cosmetic, for the cosmetic dentistry, we have a lot of materials that we use. We can start by the bleaching. The bleaching, we have two kinds of bleaching: the home bleaching and bleaching in office. Home bleaching, this is the you will take. I will take compression for the patient, and we make tray. Then, in his home, before he will sleep, he will put some materials, bleaching materials, and put the tray in on his teeth. So for 15 minutes, then this is give him after time. That's meaning he will take maybe 2 weeks or 3 weeks.
Okay.
You will give him bleaching, or the bleaching in office. This is the concentration of the materials is very high, plus 38%.
Indeed. And Dr. Mظفر, what's the difference between the home bleaching and the one say in outpatient? Because someone told me that they have about the same results, but the issue is the sensitivity. The at home is less sensitive than the one done at the dentist office.
Of course, because the home bleaching, the concentration of the materials, carbamide, it's 10 to 15%. Because you know that some people they didn't have they haven't they don't know how to use the bleaching. Sometimes they put it, they want a fast result. So they make it every time, every day, 3 or 4 times per a day. So the concentration in office in our clinic, it's very high, because the doctor, he know how many times he wanted to make it. The times we have also we use for example the zoom or laser to make what's called to give the bleaching very fast result. So there is some benefits for the home bleaching, but it's the result is very fast in bleaching in office.
So as an expert in dentistry, what will you recommend for the viewers?
For what?
For the viewers at home, what do you recommend? For them to do it at home, or is it to be
I think
supervised by a
if the
dentist?
patient has a healthy gum and he know how to make, he will brush his teeth, he has healthy gum, it's okay for home bleaching. But if there is, you are not sure that the patient, he will use the home bleaching as a correctly, no, I will make it in office. This is the first. It's not always the cosmetic. It's not only the bleaching. We have only also we can treat the broken teeth. This is also cosmetic as a cosmetic dentistry also. Third, we can make also if there is a problem in bite or another things for example rotation of tooth. Orthodontics is also we can apply for some patients.
Right. Now, doctor, let's say as we're talking about all these clinical procedures or home procedures, especially when it comes to whitening, we understand there are so many of the people and they have different practices even that they do at home that they say would whiten the teeth. The best one amongst all of the ones that I have heard would be rubbing a strawberry on your teeth, because they say that because of the natural properties of a strawberry, it could really help to brighten up your smile. But there are people who use baking soda, to hydrogen peroxide sometimes to rinse their mouth with it, and they feel that it's going to whiten the teeth, and many of those different practices that people do at home. In all these practices that people are doing at home, to the ones that are done at a smile studio or at a dental clinic, we get to see that they are not really going to give you very long-term results. Like for myself, I used to have plasma whitening for a long time for my teeth, and every time I would go for the plasma lights, the doctor would tell me that, listen, do not eat brown bread, do not eat brown rice, do not eat chocolate, do not drink a lot of coffee, because all of that is going to start to stain your teeth again. So with our food practices, the things that we are eating every day, we are going back to the problems that we were already trying to take care of. So it keeps on happening. The more I get my teeth whitened, the more I will have the problem of staining and all those things, because every time your dental enamel gets thinner and thinner, and you are more likely to have problems. What is the solution? Is there a permanent solution for beautiful smile?
Okay, we have another, but I wanted to explain, before I make bleaching, I have to explain to my patients that there is no bleaching forever. If you drink any soft drinks, like I drink tea, coffee, anything, this will return your teeth in its color. So now there is a new act that we make it to give the patient a permanent smile. That's called veneers or lumineers.
Yeah.
Or they called it Hollywood smile.
Yeah.
So this okay, but that's not meaning that he will not brush his teeth. Of course, this is permanent. You can choose the shade of your teeth, the shining,
size also?
everything.
Yes.
No, yes, the size. They will make ideal smile.
Whatever is ideal for your face.
No, this depend on the face. That's meaning there is some people that they have long face, a round face. This is that's depend on the face of the patient.
So whatever's appealing for that patient.
Yes.
So let me ask you here, Dr. Muzaffer, like for instance, when people go to plastic surgeons, sometimes you get to see people, let's say if there is a celebrity that they really like, let's say I like Nancy Ajram or Angelina Jolie. I bring the photo to the plastic surgeon and I say, I want a nose like this. Now, does this happen with the dentist as well, that people will bring you a picture, I want a smile like this, I want Julia Roberts' smile?
No, I don't think that, but...
Is it possible or it is not? Because each one has a different structure.
Each one is, it's difference between as I told you, that's the face, the smile, the nose, everything. This is depend on the teeth, but we try to make ideal smile to all the patients in our, because there is some problems for the patient. It's not only the appearance, the external appearance. Sometimes if I external appearance, but I have bad bite, or I can't breathe, or sometimes there is a
If
another
it
problem.
affects your functionality.
Yes.
Yeah.
Because a lot of people, like, they think it's like when they have white teeth, they think, okay, I'm just gonna wear it, I'm gonna look good. But like you mentioned, it's like they can have some health problems, whether they're not biting right, or one of the issues someone informed me about is like at night, where they bite too much and they start grinding the teeth. There's some of the issues a lot of their viewers need to really understand and consult with an expert dentist, because this is not, you don't want to just cover the issue, you want to solve the issue, but you also want to look good at the moment. And Dr. Muzaffer, what kind of problems can veneers correct? Because I don't want the dear viewers at home just think I'm going to go get veneers and that will solve all the problems. What kind of problems can it correct, and what are the problems that it cannot correct?
Okay, you ask about the veneers.
What problems can it correct? Because I don't, because some of the viewers may think if I just take veneers, it will solve all the problems. I'll look good, it'll be okay.
No, of course there is some problem. I will tell the patient that there is some information before he make anything of cosmetic. For the veneers, if the patient has a missing teeth, I can't make veneers. So I will make bridge, okay, in zirconia or another bridge. But for veneers, we can correct the problem of the appearance of teeth. Some people have fluorosis. This fluorosis, the percentage of fluoride is very high in teeth. If you make bleaching, you will not make the solution for that. But also, I am always tell the patient that he has to brush his teeth, take care of flossing, take care of his gum, because this is the important. It's not only the appearance, then I have a lot of problems.
The hygiene behind it.
Yes, the hygiene is very important.
Indeed. And Dr. Muzaffer, what is involved in the veneer procedure? Because some people just says like, I just hear about it, at the end result is good, but they don't know what's going on in the doctor's office. Because some of them are afraid of drills, they just want to be put asleep in local anesthesia. But can you please explain for the viewers at home, what's involved in the procedure? Okay,
we have the veneer and lumineer. The veneer is, we will make preparation for the buccal face of anterior teeth or the teeth that's appear on smile. So we make preparation for 0.8 of millimeter. So we will take impression and the laboratory will make the veneer. This is for veneer. For lumineer, we will not make any preparation. We take impression. It's like lenses.
Yes.
It's the same, but it's very, very small thick. It's not. It's very thin.
Okay. So it's like contact lenses for the teeth.
Yes.
Teeth. That's something just cover up.
But it's permanently. It's not. He can't remove it.
What the veneers, are they made of a very strong substance?
Yes, it's made by zirconia. It's very strong material.
And what are the difference between traditional dental veneers and the minimal veneers? I think there's two types of them.
The minimal, what's the other?
There's traditional dental veneers and minimal veneers.
Lumineers?
Lumineers. It's lumineer or laminate veneers. Yes, because we can't make. We didn't make any preparation for the tooth. So it can make adhesive on the teeth. The buccal face is very important in appearance.
Indeed. And Dr. Muzaffer, many of the people think it's like to look good anywhere around the world, whether in the kingdom or United States and Hollywood, they have a belief that it has to be the whitest teeth possible. So like they want to be the person that they can spot out of the room when they smile, it's completely white. Why is that so? They have the false belief of having the whitest teeth. I don't know, a lot of the dentists that I ask, they say no, you have to have that natural look. They have to have a little discoloration because it seems natural. Because if you just, like me, just smile, when I have like white, like this paper white, it seems kind of abnormal.
Yes.
Can you please tell us more about that?
This is the important thing. We have to make the natural smile. It's not the what's called white like white. No, because some people they can if they smile, you can look at
like yes. they had some work done.
You need to wear sunglasses.
Sunglasses or some you have light like that. So it's important to give natural and to explain for the patient, because you know that some patients they want only white, but it's the important thing is the natural shape and color.
Yes. And Dr. Muzaffer, many of the viewers think it's like, you know, when they have many times the whitening, they say about 2 years. It can last about, it depends on the type of whitenings. They believe that they'll be okay, they can just do it every 2 years, but they don't understand the consequence of it. Many dentists inform me that when you do it too much, it feels like your teeth, it's going to be like almost a see-through, because you're destroying your enamel, and when you don't have enamel, your teeth is going to be sensitive to cold, to hot, and you don't have the strength of like the teeth that it originally has because of the whitenings. It becomes to a certain point where they have to take artificial teeth. Can you tell us more about that?
Yes, for the bleaching, it's okay if you make it every 2 years. It's okay because the materials of bleaching is acid.
Okay.
So it will be attack the enamel. The enamel is the first defense on the tooth. So if you make it like always, it will make a destruction of the enamel. You have sensitivity. Sometimes there is the caries will appear. So it's important to know how many times. It's not always the appearance of your teeth, but you have another problems. Yes.
Yes. And Dr. Muzaffer, like you mentioned, Saima, it's like every time you go there, you have to avoid coffee, you have to avoid any, very colored juice or anything that can kind of like, especially sugar, where it can stick to the teeth and cause many of the, I'll say, stains of it. Is this becoming more of an issue for the people that keep having to white over and over again? They're not satisfied, they keep relapsing, like many of the dentists say. Can you tell us more about that, about the relapse part?
Okay, for the bleaching, I told for the patient the first 4 days they have to don't drink any colored drink or for like coffee, soft drink. Because the tooth it's very sensitive to any color. So after that, he has to brush his teeth. We can give him there is some toothpaste. He can use it only once a week.
Oh, this is the one with pumice in it?
Yeah. This is because the patient he has. I will explain for him everything before I start.
Yes.
Because some people they can't live without drink coffee or tea.
True. But Dr. Muzaffer, now we have been talking about cosmetic dentistry, which is so much about giving new things to your teeth. So either you're enhancing the look or the color or whatever it is. Now we understand medical insurance that most of the people use in Saudi Arabia does not cover any cosmetic dental procedures, so you have to pay for it. Now a lot of the people want to, but they cannot pay for it because they don't have that much money to spare, and such kind of cosmetic dental procedures are a little pricey as well. Of course, minus the bleaching is very affordable for everybody, but the rest, they could be very costly. So when it comes to taking care of our teeth, what are some of the things that we can do naturally to keep our teeth white? For instance, like when every time it is that, let's say if we're drinking 3 cups of coffee every day or 3 cups of tea every day, is it good if we right after drinking our tea or coffee go and brush our teeth? Would it keep our teeth whitened, our natural teeth clean in color? Or if we are eating some of the foods like, which we know are heavily pigmented, like let's say Dijon mustard or some kinds of mustards, it's really, bright in color. So we can understand if it's going to stay in our teeth or in our mouth for a long time, then it could, affect our smile. So if we brush our teeth immediately after eating any pigmented foods, do you think that would help?
Okay, the first is the prevention for the patients. They brush his teeth. He will not need any another bleaching or another cosmetic act. The other thing is usually he have to visit the doctor once or twice a year. So there is we can make scaling and polishing. It's enough for some people. But if the patient he wanted to make a very beautiful smile, he will pay for the other.
Indeed.
Right.
And Dr. Muzaffer, before we conclude today's discussion, any last words or advice you'd like to give our dear viewers about everything that we discussed today?
I wanted to tell the last thing about their using of laser That's meaning the cosmetic dentistry is not only the teeth, we can make it the gum. We can use the laser to remove the pigmentation in the gum, to make, to reshape the healthy gum. So it's important to know that there is another thing, not only the teeth. Finally, I wanted to congratulate all the Saudi people for the occasion of National Day next week, and thank you.
Thank you so much,
Thank you
Doctor.
so much for your advance greetings, Dr. Muzaffer. That was really, really kind of you. And we're going to be definitely having very big celebrations for the Saudi National Day, so you
Inshallah.
must be watching Channel 2. And with this, thank you so much for being with us. And we hope that lots of the people would be able to have the beautiful smile, that they would be wanting to smile all the time, flaunting their smile. And well, life gives us so many of the reasons to smile, so always, always try to smile and be thankful for all the blessings that you have in your life. For the moment, we are embarking on towards a quick report. We'll be joining you shortly afterwards. Stay with us.